Begin with Ebola. The fifth American infected in West Africa will arrive in Nebraska this morning for treatment. Mashoka Mukpo will be placed in an isolation unit. He got the disease while working as a news cameraman in Liberia.
Meanwhile, the Ebola patient in a Dallas hospital is in dire shape. Health officials are keeping track of anyone Thomas Eric Duncan made contact with. In a moment, we're going to talk to CDC Director Tom Frieden about stopping the spread of Ebola. But first, Manuel Bojorquez in Dallas is tracking the first victim diagnosed here. Manuel, good morning.
Good morning. We've learned 7 healthcare workers and 3 family members are considered to have had the closest contact with the patient while he was sick. They are being closely monitored, and so far none has shown symptoms. Duncan has been in an isolation unit here at Texas Health Presbyterian Hospital for a full week now, but his condition has gone from serious to critical. Hazmat crews covered from head to toe did another sweep of the apartment Sunday where Thomas Eric Duncan stayed before he was taken to the hospital. Doctors so far have not used experimental treatments on Duncan. When asked, Thomas Frieden, director of the Centers for Disease Control and Prevention, said there's a reason.
The medication you mentioned can be quite difficult for patients to take and may transiently worsen their conditions.
Efforts to isolate potential new cases continue. Health workers are checking on nearly 50 people who may have had contact with Duncan. Authorities put out an alert yesterday when they couldn't locate Michael Lively, a homeless man considered a low-risk contact. He was the patient in this ambulance immediately after Duncan, but within hours they found him. It was yet another challenge for officials trying to prove their efforts are working.
I'm absolutely confident that we will stop Ebola from spreading here.
Judge Clay Jenkins, Dallas County's top administrative official, has emerged as the face of the response, choosing to visit quarantined family members without protective gear, and even driving them to a new location, an isolated home in an undisclosed gated community, to calm public fears.
There's zero chance you're going to get Ebola from being near an asymptomatic person.
He acknowledged there have been missteps, including the hospital's initial release of Duncan when he first showed up with symptoms.
Mistakes were made. The hospital's been very forthright that they made mistakes.
Were people really prepared for this?
The county had a protocol in place that unfortunately was not followed.
Exactly why Duncan was initially released is still unclear. At first, the hospital said there was a flaw in the way electronic records interacted, but later said there was no flaw in their system and the medical team did have access to information that Duncan had come from Liberia. Charlie?